topic, right? If I start there, that will stop diabetes, cholesterol, obesity, everything. That's my genre.
So there's no specific food related to cancer.
No, it's being healthy. Obviously, you don't want cancerogens, carcinogens, everything outside, everything that's colorful. I say try not to have, right? Everything added color. Try to be more natural as possible.
Sugar is also connected to cancer.
It depends on the kind of sugar. Generally, it's the processed sugar. I think in our WhatsApp group, there's a video that floated last few days about wheat and diabetes. How many did you see that?
No.
Okay. So I'll tell you, this is what I preach when patient comes to see me in the clinic for diabetes, but somebody did. Little bit overemphasis on the video, but I generally say in the end you should look at it as carb. Okay? Carb, sugar is pure sugar, right? But the important aspect you have to look at is as a carb. Anything that has to do with carb, you have to be careful. Because you want a healthy BMI is nothing but not being obese. Indirectly they're saying is don't be obese. So how do you cut down the obesity? Not only eating sugar but eating less number of carbs. To your point is cutting on the rice. People think you can eat wheat, you can eat oats. No, not true. All carbs are in the same class. It's just a little bit one versus the other, but in the end all do the same thing. So you want to add more fiber, more proteins in your diet, less of the carbs. Mainly I would stress on processed food. Try to do less processed food. Endotoxins, there are so many fancy terms these days, especially in the context of women, PCOS. They call endocrine disruptors is the new word that they use. It's all things that they put in the food. One thing I realize I tell is more you eat outside, the craving to eat outside food increases because they put stuff that makes you crave for that. So always be careful in what you're picking. No colors, no dyes. Try to be more natural as much as you can.
So you mentioned that men also develop breast cancer.
Yeah.
So what is just like maybe they go for checkup. Similarly,
Absolutely, yes. So mammogram also is the screening test for men. Men can develop breast cancers. They can have small breasts, but yes, the guidelines don't change. Definitely, you should seek attention, or anybody should seek attention, even men.
Any questions?
I have one question.
Yeah.
Why is it that only in this case, in the case of mammogram, there is the risk of what is that? Radiation, induced radiation.
Right,
or something.
breast cancer.
We take X-rays for other things as well, like for chest and other.
Yeah.
But why only in this case there is that risk of developing cancer?
So it is cumulative effect, right? One, when you're doing an X-ray for some other illness, you're doing once in a while, right? But here you're talking about years, right? This has been going on for many, many years, many decades, right? So it's a cumulative effect. And the other thing is this: the X-ray techniques also has gotten better. This is based on, as I said, there's no concrete data. I had to look for it because that's a common question that people ask me. But the X-rays these days have a less radiation, they have a lower radiation, so it might even be less than that. Generally people say barely that is a concern. In other words, barely it is a concern when you look at the big spectrum. So you're doing this often, right? And you're starting at 40 to 75. So that's a valid concern people have.
Now it's even though we have insurances and everything, right? Now it's getting very expensive or costly. But these are all taken care by
Yeah,
insurance.
absolutely. Every insurance covers mammogram screening test. Other things there are for people. I mean, if someone has a financial difficulty, every healthcare has a very good breast care program. Mainland has a breast care, Penn has a breast care program, and they have programs that can accommodate for people who are financially challenged.